Have you ever considered that your nightly routine could be endangering your life without your knowledge? It might seem surprising, but according to the Centers for Disease Control and Prevention, annually, over 70,000 older adults die in their sleep in the United States. What's concerning is that many of these deaths are not merely a result of aging. These are linked to minor, avoidable nighttime behaviors that many individuals seldom consider. Beyond the age of 60, your body undergoes changes that are subtle yet significant. Your heart grows more delicate, your lungs become more susceptible, and your brain becomes more sensitive to disturbances. Sleep becomes more shallow, your muscle strength diminishes, and activities that seemed benign at bedtime can subtly become hazardous. Nevertheless, many older individuals continue with their usual practices, not recognizing that these routines could be silently damaging their long-term health and well-being. Therefore, what are these hidden dangers lurking in your nightly routines? What is the most frequent bedtime error that results in a higher number of overnight emergencies than any other? And even more crucially, how can you immediately improve the safety and health of your sleep? In this video, we will explore 7 nighttime routines that have proven fatal for numerous seniors already this year. You'll need to pay close attention to habit number 2. It's surprisingly harmful. But don't worry, I'll provide you with straightforward steps to safeguard yourself starting tonight. If you're new here, welcome to the channel. Let's work together to become stronger and healthier. Make sure to like this video and click the subscribe button so you don't miss our upcoming updates. And hey, please share your country in the comments below so we can see where you're watching from. We love to observe how our global community expands. Now, let's get started. Habit number 7, consuming too much water before bedtime. Let's discuss one nocturnal habit that appears benign, but may be subtly jeopardizing your health. Drinking too much water before going to sleep. Staying hydrated is crucial, particularly as we grow older. Water maintains your organs' function, aids in digestion, and keeps your joints supple. However, while it's important to drink sufficient amounts throughout the day, consuming a lot of water just before going to sleep can have adverse effects, especially for seniors. As we age, our kidneys become less efficient at processing liquids, and our bladder capacity diminishes. Additionally, the cues that alert us to the need for a bathroom visit become more immediate and more common. Therefore, if you consume a significant amount of liquids like water, juice, or herbal tea shortly before bedtime, you're more prone to have your sleep disrupted by the need for frequent bathroom breaks. Now, waking up once or twice may not appear to be a significant issue, but for older adults, it heightens the risk of falls during the night. Imagine this. You're disoriented. The room is dimly lit. Your equilibrium isn't as steady as it once was, and rising too swiftly can reduce your blood pressure. This sudden journey to the bathroom might lead to a hazardous fall. Indeed, the Centers for Disease Control and Prevention indicate that falls are the leading cause why older adults are admitted to the hospital. Numerous of these incidents occur when visiting the bathroom at night. However, this is not the sole worry. Frequently waking up to urinate interrupts your sleep cycle, particularly the deeper stages which are crucial for rejuvenating brain and body functions. Persistent disturbances in sleep are linked to memory impairment, increased inflammation, and a higher likelihood of developing disorders such as dementia and Alzheimer's disease. Inadequate sleep may also compromise your immune system and exacerbate issues like diabetes and hypertension. There is also an increased risk to heart health. Drinking excessive fluids in the evening forces your heart to work overtime to handle the additional volume. For individuals with pre-existing heart conditions, this can lead to abnormal heart rhythms or put undue strain on the heart. So, what's the safest method to stay hydrated? It's all about timing and balance. Make sure to drink sufficient water in the early part of the day, then gradually reduce your intake as the evening approaches. Make an effort to reduce your fluid consumption at least 2 hours before bedtime. Should you get thirsty prior to sleeping, opt for just a few sips rather than an entire cup. Additionally, steer clear of caffeinated or diuretic beverages such as black tea, coffee, or citrus juices late in the day. They'll only lead to more frequent trips to the bathroom. If you must get up during the night, ensure your path is secure. Utilize night lights or motion-activated lamps and remove any clutter that might cause you to trip. Rise gradually. Allow your body a moment to adapt and proceed with caution. These minor adjustments can assist you in maintaining hydration without compromising your sleep or jeopardizing your safety. Habit number 6, consuming food late at night. It may appear innocuous to indulge in a small snack before bedtime, particularly following a tiresome day. Yet for older adults, this frequent practice might covertly impact your health more significantly than you might realize. That nocturnal snack may seem soothing, yet it can trigger a series of problems that extend beyond mere indigestion. As we age, our body's ability to process food alters. Our metabolism decelerates, digestion becomes less efficient, and regulating blood sugar and cholesterol levels grows more challenging. Therefore, consuming dense or opulent meals in the late evening can prevent your digestive system from having the necessary rest it requires. Rather than restoring itself overnight, your body remains busy processing the meal, which not only disrupts your sleep, but also increases strain on your heart, liver, and digestive systems. A frequent issue stemming from eating late at night is acid reflux. Lying down post-meal allows stomach acid to move upward into your esophagus, leading to a painful burning feeling in your chest. For older adults, this condition is more than just uncomfortable. It can result in inflammation, harm to the esophagus, and even aspiration pneumonia if particles are inhaled during sleep. Research published in the American Journal of Gastroenterology indicates that individuals who consume food within 3 hours of going to bed are significantly more likely to suffer from reflux and its associated complications throughout the night. However, that's not the sole problem. Consuming sugary snacks or refined carbohydrates in the evening can elevate your blood sugar levels. As we get older, our cells often become less sensitive to insulin, complicating the management of glucose effectively. This could result in type 2 diabetes or exacerbate it if you already suffer from it. A 2020 study published in the Journal of Clinical Endocrinology and Metabolism found that late eating is associated with elevated blood sugar and insulin levels in the morning, particularly in older adults. Additionally, there's an aspect you might not immediately detect your blood pressure. Typically, your blood pressure lowers during sleep, allowing your heart to rest. However, consuming a meal late at night, particularly one rich in fats or salt, can maintain high blood pressure throughout the night. This heightens the risk of experiencing a stroke or heart attack. Furthermore, substantial meals in the evening can sometimes provoke irregular heartbeats, posing a significant risk for individuals with pre-existing heart conditions. So, how can you savor your meals while maintaining safety? The solution is found in timing and wise dietary selections. Aim to have your final meal at least 3 hours before going to sleep to ensure adequate digestion. Choose lighter, well-rounded dinners that include vegetables, lean proteins, and whole grains, while avoiding heavy, oily meals and sugar-rich desserts. If you find yourself truly hungry afterwards, opt for a small, soothing snack, such as a banana, a spoonful of plain yogurt, or a handful of unsalted nuts. These choices are gentler on your stomach and will not cause a surge in your blood sugar levels. By making small adjustments to your daily routine, you can enhance the quality of your sleep and reduce the likelihood of facing significant health issues such as heartburn, elevated blood sugar levels, and cardiovascular strain. Ensuring your body gets the restorative sleep it requires will make you feel more robust and healthier every day. Habit number 5 involves sleeping in an incorrect posture. Everyone has a favorite sleeping position, whether it involves curling up on your side or stretching out on your back. However, many older adults may not be aware that the sleep position they prefer could subtly endanger their health. As you get older, your sleeping posture can influence everything from your respiratory and cardiac functions to your brain health. Let's start by discussing one of the least beneficial sleeping positions for older adults, lying flat on your back, or the supine position. Although it might seem comfortable, this position can lead to a series of health complications. When you sleep on your back, gravity causes the tongue and throat tissues to fall back, which reduces the width of the air passage. This is particularly worrisome for individuals who snore or have sleep apnea. Even in the absence of an official diagnosis, this constraint can diminish airflow. Research from the Mayo Clinic Sleep Disorder Center indicates that sleeping on one's back can exacerbate breathing problems by up to 40% compared to side sleeping. The consequences of limited airflow are severe. A decrease in oxygen levels during sleep heightens the likelihood of obstructive sleep apnea, which results in frequent disruptions in breathing. Prolonged occurrences may elevate blood pressure, cause damage to the brain, and substantially increase the likelihood of experiencing heart attacks and strokes. Studies reported in the Journal of Clinical Sleep Medicine indicate that seniors who sleep on their backs have a 22% increased risk of nighttime cardiac events compared to those who sleep on their side. However, cardiac concerns are not the sole issue. For seniors suffering from acid reflux or a hiatal hernia, sleeping on the back may exacerbate symptoms. This position facilitates the upward movement of stomach acid into the esophagus, possibly leading to silent reflux during sleep. This condition can harm the lining of the throat and increase the risk of aspiration pneumonia. Should acid repeatedly enter the lungs, continual exposure might eventually cause esophageal cancer. There is increasing evidence indicating that the position in which you sleep impacts the brain's capability to cleanse itself. Research conducted by experts at Stony Brook University revealed that lying on your back while sleeping diminishes the brain's waste removal system by over 60%. This system plays a crucial role in eliminating harmful proteins, some of which are associated with Alzheimer's disease and dementia. This suggests that improper sleep posture might accelerate cognitive deterioration in elderly adults. Additionally, sleeping on your right side has its disadvantages. It may compress significant blood vessels close to the heart, disrupting circulation and increasing the likelihood of heart failure, particularly in older individuals with pre-existing heart issues. So, what is the safest way to sleep? Experts concur that the left side is optimal. Sleeping on your left enhances circulation, supports healthy digestion, and lowers the risks of acid reflux and stroke. It additionally enables your brain to more effectively clear out waste, safeguarding your cognitive function over time. Initially, changing positions may seem uncomfortable, but there are techniques to simplify the transition. Place a solid pillow between your knees to maintain hip alignment, and position another pillow behind your back to prevent yourself from rolling over. A carefully crafted neck pillow can support your spine and maintain your head in the correct position. If you suffer from reflux, elevating the head of your bed slightly can also have a significant impact. It might require some practice to get used to sleeping on your left side, but the health benefits are definitely worthwhile. By modifying your sleeping environment, you can reduce your risk of respiratory issues, cardiovascular stress, and cognitive deterioration, thereby enhancing your sleep quality and promoting a healthier outlook. The fourth habit to avoid is sleeping in a warm room. As we age, we frequently desire warmth during the night. It's perfectly normal to seek comfort, perhaps by raising the thermostat, piling on blankets, or ensuring windows are firmly closed. However, here's an interesting fact that often goes unnoticed. A cozy bedroom might quietly pose a risk to older adults. For seniors, Creating the ideal sleeping environment is not only about comfort, it's crucial for maintaining health and safety. Your body naturally reduces its core temperature to signal that it's time for sleep. This decrease in temperature assists you in reaching the deepest and most restorative stages of sleep. However, if your room is too hot, typically above 20 degrees Celsius, your body finds it difficult to dissipate heat. Rather than transitioning into relaxation, your body remains active as it attempts to cool down. This often results in disrupted sleep, frequent awakenings, and a sense of exhaustion the following day. However, the effects of heat on sleep extend beyond mere restlessness. Older individuals are particularly susceptible as the body's ability to regulate temperature diminishes with age. Research documented in the American Journal of Geriatric Psychiatry indicates that older adults who sleep in warmer settings may experience up to 30% reduction in deep sleep. This phase of sleep is crucial for memory consolidation, supporting the immune system and repairing cells. The absence of this critical sleep stage can lead to significant health issues. Poor sleep quality is linked to increased inflammation, higher blood pressure, and weakened immune function. These consequences heighten the possibility of severe health problems such as heart disease, type 2 diabetes, and cognitive decline. The same studies indicate that chronic sleep deprivation from heat can also accelerate memory impairment and make the body more susceptible to infections. Additionally, a hidden hazard of an overheated room is dehydration. Older adults frequently experience reduced thirst and lose both fluids and electrolytes through sweating at night. This dehydration not only impacts fluid balance, but can also thicken the blood, heightening the risk of blood clots, arrhythmias, or even a stroke. For individuals with cardiac or respiratory conditions, managing body heat during the night may lead to severe issues such as heart failure or respiratory distress. So, what's the ideal sleeping temperature? Specialists advise maintaining your bedroom from 15 degrees C to 19 degrees C. Opt for lightweight, breathable linens such as cotton sheets and steer clear of bulky comforters or electric blankets that trap excessive warmth. If you often feel cold, opt for multiple blankets that you can take off as needed. Using a fan or slightly open window can enhance air circulation and lessen accumulated heat, maintaining a refreshing atmosphere in your room. Minor adjustments to your sleeping area can make a significant difference. Lowering the temperature in your bedroom doesn't only make it more comfortable, it also safeguards your heart, maintains your memory, and promotes better sleep quality. For older adults, keeping a cooler sleeping environment is an easy yet effective way to support healthy aging. The third habit, rising from bed too rapidly, involves moments when you might wake up at night, swing your legs over the side of the bed, and suddenly experience lightheadedness or a sensation that the room is spinning. You are certainly not by yourself, and it's not merely imaginary. For older adults, sudden movements when getting up from bed can be more hazardous than many might think. This single behavior is responsible for numerous falls, injuries, and trips to the emergency room annually. The cause of this problem is something referred to as postural hypotension, also known as orthostatic hypotension. It occurs when your blood pressure suddenly falls as you stand up from a lying position. As we get older, our circulatory system becomes slower at adapting to changes in posture, allowing blood to accumulate in the lower body. This temporary reduction in blood flow to the brain can result in sensations of dizziness, blurred vision, or even a short episode of fainting. This isn't merely an uncomfortable inconvenience, it's a genuine concern. Studies published in JAMA Internal Medicine reveal that older adults with postural hypotension have an increased risk of experiencing falls, fractures, and even death. Falls are the leading cause of injury-related hospital admissions among the elderly, with many incidents happening late at night or early in the morning when the body is still adapting after sleep and blood pressure is typically lower. The consequences of a single fall can be severe. Common injuries include hip fractures, head injuries, and broken wrists. Recovery can be lengthy and difficult, and for many individuals, one fall may signal the start of decreased mobility, loss of independence, or significant long-term health issues. That's why it's crucial to address this habit with the seriousness it warrants. Luckily, preventing this issue doesn't demand significant effort. The most effective measure is to take things slowly. Upon waking, spend a few moments to sit up straight on your bed, giving your body a chance to adjust its blood circulation. Wiggle your feet, bend your ankles, and take deep breaths. These simple actions aid in stabilizing your circulation and reducing fluctuations in blood pressure. Place a glass of water beside your bed and take slow sips before you get up, particularly if you often feel dehydrated upon waking. It's also vital to ensure safety in your surroundings. Confirm that the path to the bathroom is clearly illuminated, either through the use of night lights or motion-sensing lights. Steer clear of socks that slip and opt for slippers with non-slip soles instead. Remove clutter and rugs from pathways to avoid trips. Whenever feasible, use a dresser, bedpost, or grab bar to hold onto for added stability while getting up. If you are taking medications that influence blood pressure, including diuretics or beta blockers, consult your physician. They might recommend modifying your dosage or altering when you take your medications to decrease risks. Simple adjustments to your evening routine can significantly reduce your risk of a serious fall and assist in preserving your independence and safety. Thus, avoid hurrying as soon as you wake up. Allowing yourself this time is not merely about enhancing your well-being, it's an essential aspect of safeguarding your health with each passing night as you grow older. Habit number 2, overlooking snoring, breathing interruptions, or persistent insomnia. Many individuals consider snoring a trivial irritation, particularly as they get older. However, what if those nighttime sounds or the instances where breathing appears to halt indicate something far more serious? For older adults, dismissing these symptoms can result in severe and potentially fatal health issues that frequently remain unnoticed. One of the most neglected but dangerous conditions impacting seniors is obstructive sleep apnea. This disorder occurs when the muscles in the throat overly relax during sleep, leading to a narrowing or closure of the airway. When this occurs, respiration halts momentarily, often occurring dozens or even hundreds of times during the night. Each instance causes a drop in oxygen levels, compelling the heart to exert more effort and placing additional stress on the whole body. Over time, this continual strain can lead to high blood pressure, abnormal heart rhythms, and significantly increase the risk of stroke or heart attack. The figures are quite startling. Research from the Sleep Heart Health Study indicates that untreated sleep apnea increases the risk of deadly heart attacks by 30% and strokes by up to 60% in older adults. It's estimated that nearly 4 in 10 seniors may suffer from sleep apnea. Approximately 80% of these cases remain undiagnosed. Many people just think that snoring, or often waking up, is a normal part of getting older, not realizing it could be a significant hidden condition. However, the implications extend beyond the heart. Sleep apnea and chronic sleep deprivation deprive the brain of the essential deep rest it requires. Without adequate sleep, older adults might experience memory lapses, mental confusion, and even early signs of cognitive decline. Research indicates that untreated sleep apnea may result in the loss of brain tissue, particularly in regions that control memory and reasoning, happening nearly 3 times quicker than normal age-related changes. So, how can you tell if sleep apnea or a similar problem could be impacting you? Typically, it's another person, such as a spouse or caregiver, who first detects the symptoms. The main warning signs to watch out for are loud snoring, struggling for breath while asleep, significant pauses in breathing, or often waking up during the night. You may also experience headaches in the morning, a dry mouth, or feel unusually fatigued during the day, despite having spent a full night in bed. Insomnia, which can manifest as trouble falling asleep or staying asleep, is another significant indicator. While it's normal to experience occasional sleeplessness, persistent insomnia could be a sign of underlying health issues such as cardiac, neurological, or hormonal imbalances. It also compromises the immune system and increases stress levels, making it more difficult to control conditions such as hypertension and diabetes. If these symptoms resonate with you, it's important to act now. Consult your doctor or a sleep specialist. Interventions like CPAP devices, modifications in lifestyle, and weight management can significantly lower health dangers. Indeed, studies indicate that effectively handling sleep apnea may decrease the likelihood of cardiac incidents by up to 42% in the elderly. Snoring and restless nights are not merely annoying behaviors. These are significant health warnings. Paying attention to them can protect your heart, boost your brain, and enhance your general health as you grow older. The first habit is taking specific medications before bedtime. For numerous seniors, taking medication at night is a standard part of their evening routine. Whether it's a pill for sleep, blood pressure, or joint pain, it seems like a safe action before bedtime. However, the reality is that some of these common medications may carry concealed risks when consumed at night. Particularly as we age, our bodies metabolize medications differently. We'll start with discussing sleeping pills and anti-anxiety medicines. Medications such as benzodiazepines, which include diazepam, clonazepam, and alprazolam, are formulated to calm the nervous system and facilitate easier sleep onset. However, they also decrease respiratory rate and lower alertness. For older adults, particularly those with pre-existing heart or lung conditions, this impact can be hazardous. Studies published in the British Medical Journal indicate that older individuals who regularly take these medications are at a higher risk of experiencing falls, fractures, and even early mortality compared to those who do not. The grogginess doesn't merely persist through the night. It can extend into the following day, leading to unsteadiness, confusion, and an increased risk of hazardous slips or falls. And it's not just sleeping pills that are worrisome. Muscle relaxants and certain antidepressants, typically prescribed for nighttime use, can disrupt the deep sleep stages essential for keeping your brain alert. Prolonged use of these medications could lead to memory issues, mental cloudiness, and could potentially accelerate cognitive deterioration. Additionally, it's advisable to use pain relief medications with care. NSAIDs, such as ibuprofen and diclofenac, while beneficial for painful joints, may strain the liver and kidneys with regular use, especially during the night. They can also heighten the risk of internal bleeding, especially when combined with other medications that influence blood clotting. Another typical medication taken at night is for controlling high blood pressure. While some individuals find it advantageous to take these medications in the evening, others might encounter a significant decrease in blood pressure while sleeping. This reduction can lead to diminished blood circulation to the brain and cause symptoms such as dizziness, fainting, or potentially a stroke. Research featured in Hypertension has shown that the timing of blood pressure medications profoundly impacts heart health during the night, and reactions vary from person to person. We must also consider drug interactions. As we get older, our metabolism slows down, allowing medications to accumulate in our bodies. Using various sedatives, painkillers, or heart medications without proper instruction can lead to dangerous or potentially fatal outcomes. So, how can you stay safe? Always consult your doctor or pharmacist before beginning, discontinuing, or changing medications. Inquire if there are non-sedating options available, particularly if you're dealing with drowsiness, mental cloudiness, or morning grogginess. Refrain from using sleep medications unless absolutely essential, and consider natural alternatives such as chamomile tea, gentle stretching, or deep breathing exercises to relax. If you are taking blood pressure medications, monitor your levels and immediately report any unusual symptoms to your healthcare provider. By being knowledgeable and careful with your nighttime medications, you are making a significant move to safeguard your health, prevent mishaps, and enhance the quality of your sleep. A few careful adjustments can significantly enhance the safety of your nights and the brightness of your mornings. As we conclude, it's evident that even small modifications to your evening routines can profoundly affect your health and lifespan. Now that you are aware of these 7 detrimental sleep habits, it's time to start making changes tonight. Whether it involves organizing your medication regimen, modifying your sleeping surroundings, or being mindful of your pre-sleep diet, every minor change can contribute to a prolonged, healthier existence. Have you ever inadvertently adopted one of these routines? Or perhaps you possess a clever trick that has improved your sleep quality. Please share your experiences in the comments below. We're eager to learn about your successful strategies. If you enjoyed this video, don't forget to hit the like button, subscribe, and become part of our community for more useful health insights. Your journey to improved sleep and enhanced health starts today. Thank you for joining us on this path.